Assalamualaikum warahmatullahi wabarakatuh. We are from Group 9. Today we will present about the Bekam Clinical at Kot Lanas that our choose to interview. This is our group members which is Ainun, Karina, Najiha, Aiman Adli, Atikah, Atira, Iza, Afi Aiman, Zack and Nantini.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Ainomadia binti Azmi. My number matric is H21B3131. For the company background, which is name of company is Bekam Clinical Kot Lanas, which is located at Kot Lanas. The business is run by Tuan Haji Fauzi, which is major in clinical cupping diploma at HUSM. As we know, when business use title of clinical, mostly alumni of HUSM. In addition, this business start since 2050, and lastly is Bekam Clinical Kot Lanas provide service such as cupping, acupuncture and fashru.
Assalamualaikum. My name is Karina Azri binti Azmi, H21A2310. Today, I want to explain about product or service offer our company. First thing is cupping. Has many types such as wine, wet, and dry cupping that can cure many diseases such as migraines, high blood, visual, skin problems, and so on. And number two, acupuncture is a Chinese medicine that benefits the recovery of stroke, controls Parkinson's disease, reduce insomnia, and so on. And then lastly, our company also offer service Fastu is an alternative treatment method that involves removing dirty blood from the body. This therapy is believed to be able to treat various diseases such as high cholesterol, uric acid, and stroke. That's all. That's all from me, and service and product from our company. Thank you.
My name is Muhammad Zikrullah bin Zaito and my metric number is H21A2253. I will explain the history of treatment. Cupping or hijama in Arabic is an ancient, holistic method for the treatment of a variety of diseases. Its use has been documented in early Egyptian and Chinese medical practice. Cupping has been known since ancient times, namely in the Sumerian kingdom, then continued to expand to Babylon, ancient Egypt, Sabah and Persia. In ancient China, they also called hijama as bone care because the bone replaced the glass. In the 18th century, people in Europe used leech as a tool for cupping. At the time, 40 million leech were imported into France for the purpose. A herbalist, Guy Hong, in his book, A Handbook of Precision for Emergency, used animal horn to clamp, the so-called Geoffra technique. Now this treatment perfectly modified and easy to use according to scientific principle by using practical and effective tools. The review by Curtis and J 2005 in the article Management of Urinary Tract Infection. That's all for me. I will pass for the next presenter. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Aiman Adli bin Ayub and my metric number H21A2173. This time I will present about Ask an Expert. There are 6 questions that have been asked during the interview session. These questions are based on benefit, cupping process, safety and hygiene, improving knowledge, effectiveness, and promoting strategies. All questions has been answered and understood to our group. For the next part, I will pass the next presenter. Thank you.
Hi, my name is Nantini Anupurpan Ravi and my metric number is H21B2260. Today I want to explain my part which is cultural beliefs. Firstly is balancing the body humus. From cultural belief, Encik Fauzi said that our body is composed of 4 main elements which is earth, water, air and fire. When any of these elements are imbalanced, it can lead to very physical and spiritual alignments. Cupping therapy is seen as a method to restore this balance by improving blood circulation, eliminating toxin, and also releasing stagnant energy. Secondly is balancing of hot and cold elements. According to Encik Fauzi, in Malay culture, cupping is deeply intertwined with our traditional belief and practices. One significant belief is that cupping helps restore balance in the body, which believe that our bodies are made of hot and cold elements known as panas and sejuk. When these elements are imbalanced, it can lead to various health issues. Cupping is used as means to rectify this imbalance and promote overall well-being. Third is cultural heritage and identity. Encik Fauzi also stated that cupping holds significant cultural value within the Malay community. It is regarded as a traditional healing practice that has been passed down through generation, preserving Malay cultural heritage and identity. Cupping sessions often involve rituals, prayers, and the use of specific oils and herbal preparation, reflecting the ritual cultural tradition associated with the practice. Lastly is trained and knowledgeable therapists in cultural significance and beliefs. As stated by Encik Fauzi, they strive to provide a holistic and authentic experience for their customers. Their trained therapists are not only skilled in the techniques of cupping therapy but also knowledgeable about the cultural significance and beliefs. They guide customers through the process, ensuring their comfort and well-being. He believes that cupping therapy are not only offers physical benefit but also promotes a sense of inner peace and harmony. Thank you.
Assalamualaikum and hi everyone. My name is Nur Atika binti Ahmad Syaiful. My matric number is H21A23AC. Now I'm going to explain about my part is scientific evidence. In 2011, a study was conducted by a group of the researchers led by Professor Dr. Mr. Aziz Al-Safi Ismail from the Help Campus University Saint Malaysia study the effects of cupping on the virus chronic disease. The first one is cupping reduce blood sugar level. A study conducted by a group of researchers from the University of the Western Cape found that blood sugar level decreased after cupping treatment. The second is cupping to control kidney function. Cupping can improve kidney function by lowering urine level in the blood after the third month of cupping. Next, cupping lose weight. Based on the study conducted in 2008 by a researcher, the cupping treatment method was found patients who underwent cupping treatment regularly for 3 months were able to lower their body mass index. The last is cupping lowers cholesterol level. Two other studies that were conducted in Indonesia 2010 and 2012 also produced the same result that was the decrease in blood cholesterol level after cupping treatment.
My name is Nur Ajra binti Manuel Lesnuri. My matric number H21A2299. I will continue the presentation about customer perception. According to the Become Clinical studies, most clients have a positive perception of cupping, agreeing that by practicing cupping and fashdu recommended by Encik Fauzi can provide effectiveness to customers such as controlling hypertension as well as smoothing out conversation for someone who has a stroke and so on. One of Encik Fauzi's clients said he believes cupping could be a traditional treatment option to reduce disorders and pain in the body as well as the sunnah of the Nabi Muhammad, which is not harmful to the head of the body. According to the customer, it can also be concluded that some of them know about cupping by chatting with older people so that they will recognize their experience of cupping. There was a client from this clinical cupping who has also had a stroke coming through fashdu because he did not want to operate his head. In his right brain, there was a swelling of a blood clot. After fashdu, he is also healthy from his minor stroke, now continue his daily duties as a modern pondok agama in Hulu Langat, Selangor.
Assalamualaikum and hi, my name is Nur Najah Mirza binti Ahmad Sharafi and my number matric is H21A2983. Now I will explain about the innovation. The innovation, the cups they are the most commonly used cupping tools. A cup is a container used to hold liquid which is used during cupping. The Become Clinical still use the traditional therapy which is still use the cup and hand vacuum, but there have a innovation when use the electronic vacuum for the head. We can see that the Bekam Clinical have a good innovation for their company and easy for customer and use. Not only that, the innovation they use can easy and not take a long time for their customer to do the Bekam for the Malay cupping.
Hello, I'm Nuri Izzah binti Shukri, number matrik H21A3043. I will talk about the current issue. Okay, the first issue is when there are registered practitioners who do not practice cupping hygiene in accordance with the SOP that has been set. Issue arises regarding the safety of cupping if there are alternative medical practices that do not practice the concept of clinical hygiene when undergoing treatment. There is a perception about the safety of cupping when there are a handful of cuppers who offer cupping in cleaning unsafe areas. In this show, a reporter makes a comment on several premises that offer free cupping. She found that the practitioner claimed that were used disposable treatment, but as a consumer, the reporter was skeptical because the practitioner was from a foreign country. One victim was interviewed and found to be suffering from several side effects such as lethargy, difficulty sleeping, and some were infected with HIV. Okay, the second issue is the government will consider using cupping. In the Harian Metro newspaper, clipping date March 2029, that Minister of Health at that time, Datuk Seri Dr. Zulkifli Ahmad said the government would consider introducing cupping services at health facilities. Okay, he said this when answering a question from Dr. Azman Ismail, who want to know whether the minister instead to use the cupping method in government hospitals to deal with chronic disease in addition to reducing the cost of treatment. Okay, in a technology assessment report in 2012 on cupping, Dr. Zulkifli said there is still no strong evidence to support the effectiveness of cupping in a particular disease. However, the minister will continue the study and produce a report on wet cupping for diabetes and cardiovascular disease in the near future. And the last one is lack of practitioners. Due to lack of practitioners in the cupping industry, cupping is not widely spread. This is because the community lacks knowledge about the cupping.
Assalamualaikum and have a good day. My name is Afiq Aiman bin Muhammad Salihin and my matric number is H21A2762. Today I will present about business potential and challenge, which is lack of regulation and training, treatment facility and equipment, market demand, and continued professional development. Firstly, lack of regulation and training. In some jurisdictions, cupping therapy may be unregulated, allowing untrained individuals to offer treatment. This lack of regulation can lead to inconsistent quality of care and potential safety risks. Ensuring that practitioners are adequately trained, certified, and follow appropriate safety protocol is essential for patient safety. Secondly, market demand. Assess market demand for cupping therapy in business area. Cupping operator need to research the local community interest in alternative therapies, health practice, and the availability of similar service. Next, treatment facility and equipment. Provide comfortable and well-equipped treatment facility that comply with proper hygiene standard. Invest in high-quality cupping equipment, including different type of cup such as glass, silicone, or plastic, to accommodate a variety of customer preference. Finally, continue professional development. Stay up to date with the latest research, technique, and development in cupping therapy development. Attend conference, join professional association, and network with other cupping therapists to expand your knowledge and skill. Thank you. That's only from me.